dressing, we'll put a dressing on, whatever, if they have open areas, and put an additional dressing there, and then you're going to add this. And this will allow them to get up, especially if they're grafted. It's very painful when you become in a dependent position, everything kind of just, the blood just flows, and that's where more pain is going to occur. So we try to use this, and it secures the dressings in place. So we're going to start here. I didn't wrap it very tight. So you start at their hips, and then you're just going to go in spiral. And then usually you even go across the chest area. So I'm just going to stop here. And you'll take normally, you have to use what size of ace bandage depending on the individual you're wrapping. So a smaller child who's maybe 2, you're going to use probably this size. For an older person or an adult, you're going to use a bunch of these. And the best way to do it, it's very impossible to do it while they're lying down. You normally want to do it, and see how I cover, you're going to go halfway over the one prior to. Usually have them sit up at the edge of the bed, or if they can, stand.
Sometimes it takes 2 professionals to put it on because someone has to sit the patient up because the burn is very painful, and the other person can then wrap.
So if I wrap you or anything, I want you to keep it on till the end just to see how comfortable it is, to see what you're able to do with it on. Because normally if they're out of bed, they're going to wear this whenever they're out of bed. So usually when they go back to bed, sometimes we can take these off. And normally we wouldn't use these, we would just staple it because this becomes a choking hazard for the children. There you go. And that's easy for the trunk. Any questions? The trunk's probably the easiest of all. The hand is the hardest. The foot's a little difficult too because you have to make sure how you can position the foot. You want to do a solo?